Good evening! My name's Tristan Cray. I'm a student of physical therapy assistantship at Kennebec Valley Community College, and tonight I'm going to be giving a talk on the dreaded plantar fasciitis. The reason I chose this topic is because I've been an on-again, off-again runner for a while, and I have a lot of friends who are serious runners, and I've seen people struggle with plantar fasciitis. And I know that it's also sort of a mysterious pathology. There's still a lot yet to be discovered about the causes and the best treatment, so I thought it'd be a fun topic to research. And I wanted to know, is there evidence to support the selection of one treatment over the others? And we'll see how well I did with that question. My research objectives. I wanted to know, how well studied are the various treatments for plantar fasciitis? I know there's a bunch. How well studied are they? Have any treatments proven to be more effective than others? And are we able to confidently recommend a particular treatment to our patients and friends? So the first study I looked at was out of Turkey, University of Düzce in northern Turkey, and 48 patients in 3 groups, and they selected patients who had plantar fasciitis for over 6 months, so that's a long time to have plantar fasciitis, I think, and to find that many people who had it. So what they did was they gave 3 groups, 3 different treatments here: corticosteroid injection, what they call extracorporeal shockwave therapy. And that, I found out, is used a lot around the world, maybe not so much here in the U.S., because we haven't learned about it. It's the first time I'd heard about it. And it's sort of like ultrasound, but different enough to merit a separate name. And then radiofrequency nerve ablation, which is a way of using electrical stimulation to specifically target the nerve in that bottom of the foot. So they studied the patients and measured them using they used the American Orthopedic Foot and Ankle Society scoring, which is abbreviated to AOFAS. I'm calling it ALFAS. And in this scoring system, a perfect score would be 100. That would basically mean that you have no plantar fasciitis. And as the score goes down, your plantar fasciitis gets worse and worse. So, what they found was that there was improvement in all 3 groups. This is good news. And they had slightly more improvements in ultrasound patients at 6 weeks, but this might have been an anomaly, a statistical anomaly, because at the end of 12 weeks, they were all pretty similar. There was no statistically significant difference in the 3 treatment groups. Also, there was no statistically significant difference in their 0 to 10 pain score, which they also measured. And they use the same system that we do in the 0 to 10 pain range. So this is good news, but it doesn't really help me in my question to find a particular treatment that's better than the others. So the next study I looked at is a study out of Korea, and it's out of the Wordle Spine Hospital in the Gangnam district of Seoul. So for all you Gangnam Style fans out there, this is from that place. And they had only 2 groups this time, 40 patients, and in this one they're actually their inclusion was patients who had plantar fasciitis for under 6 months, so the opposite of the first study. And what they're specifically studying here is a new shoe which has a double air, 2 air bladders, one under the heel and one under the arch of the foot, and as you go through your stride, the air transfers between those 2 air bladders, and this is thought that it might really help patients with plantar fasciitis. So they They studied the patients at two different time periods. So what they found was that group 2, which received the traditional physical therapy treatments, including steroid injections, platelet injections, the same extracorporeal shockwave therapy, and orthotics. They improved more than the ones who just wore the shoe. That was their only instruction. Just wear the shoe and don't do any physical therapy or anything. They improved more after 1 month. But then that group stopped all the physical therapy and everything. And so then they measured the two groups after 2 months, and group number 1, the group with the special shoe, kept wearing that shoe for that second month, while group 2, the physical therapy group, stopped all their physical therapy and did nothing for the second month. And so what they found was that group 1, the group with the shoe, they actually turned out better after 2 months than the group that did the physical therapy for 1 month. This is kind of an awkward comparison of time frames. But the reason this might be because it takes patient perspective of cost benefit. The shoes are a one-time purchase, whereas physical therapy, the more you do it, costs more. They used a different scoring system than the first study. They used the FFI, the Foot Function Index, and in this scoring system, the lower you go, the better your diagnosis is. So they went from so the group that got the physical therapy, they went from a 50 to a 36, which is a good improvement, but then they went up again to a 43 after 2 months, when they had been doing nothing. The group that wore the shoe, they went from a 63 to a 46 to a 35, and these are all average scores amongst the groups. So after 2 months, they still were continuing to improve pretty significantly. So I think there's some hope for this special shoe, and also hope for the traditional treatments as well. Some other strengths and weaknesses. As I said, they take the cost benefit of the patient into account. Different time frames make for awkward comparison. And it sort of seemed like they were selling the shoe a little bit, although they did state that they had no conflict of interest, so I just put that in there. Possible conflict of interest. Third study I looked at, this one is out of Ethiopia, southwestern Ethiopia to be specific. And this one found 80 patients, split them up into two groups. This is my favorite. I really like this one, even though I was kind of skeptical when I first started reading it. 12. So group 1 received 12 laser treatments over 4 weeks, and then they also did stretches. They did the kind of stretch where you cross your affected leg over the other leg, and then you pull your toes up to stretch out that bottom of your foot. And they were doing that in addition to getting the low-level laser therapy treatment. Now, the group 2, they were receiving the sham treatment, and so they were getting the physical act of applying like a laser device to their foot, but the laser was not on. So I thought this was a really cool experiment because it really takes out that placebo measure. And So for number 3, the conclusions, there was serious improvement in group 1, the one that did the stretching and the laser treatment, the real laser treatment. And again, they used the FFI, the same scoring system as the Korean study, in which a lower score is better, means that you're improving. The group 1, their scores went, and this is over the course of 1 month, their scores went from 73 to 40, so that's a drop of 33. That's a pretty big difference if you ask me, 33 out of 100, and that's in only a month. So, group B, the placebo group, they were also doing the stretches. They were also receiving, like the whatever benefits you get from having somebody look at your foot. They went from a 77 to a 68. That's only a drop of 9. So 33 compared to 9, that is over 3 times as effective. So what this is showing is that there's really something to be gained from actual treatment as opposed to just the stretching. And I'll talk a little bit about that later. And also they use that same 0 to 10 scale as well that we use. And the drop in pain for the group A was also over 3 times greater than the drop in pain for the placebo group. I would have liked to have seen that study go on for a longer duration. And one thing I also really liked about that study was that they mentioned that the laser therapy is actually a good option for less developed countries that might not have the resources for more expensive equipment. A laser machine is pretty cheap. So, my conclusions. It appears that almost all treatment methods contribute to recovery. There was not a single group in all these studies that didn't make some progress. However, I really wanted to study the concept of running. And I know there's a lot of very good runners from these countries that I studied, but none of them really mentioned running. So there's very little research on returning to running. New treatments continue to emerge, like the laser treatment and the shoe with the double air bladder. And more studies are needed on specific patient goals, like are they returning to running, are they returning to work, stuff like that. Also, interestingly, it might soon be renamed plantar fasciosis because it's not technically a inflammation. It's more of a destructive breakdown of the fascia. So that might be coming in the future. So watch out for that. I did find one systematic review, which was interesting. It was out of Italy, which sort of confirmed what I had been finding. And they studied 17 studies of plantar fasciitis in athletes. And they basically concluded that there's not enough literature to really create the best algorithm for both recreational and elite athletes. So they're calling for more research to be done, which I would like to see as well. So, here's my works cited, image credits, and I've given you a handout which has a little bit of advice from me. And yeah, pay attention to your feet. Where exactly on the bottom of your foot is the pain every morning? And also, treatments seem to be better when they're bundled together. You're doing multiple treatments at once, whether it be stretching and modality. Yeah, go for the bundle, and also keep an eye out for new scientific discoveries, new treatment methods, because it's still a new science, and there's a lot of stuff being done and yet to be done. Thank you.